Thank you, Mr. President. Thank you, colleagues. This bill spends $1.6 billion, and in 6 hours, we passed one amendment that raised the level of funding in this bill. And we were happy to do that because it went toward foster children, and we think we'll be able to put it in. The rest of the time was on procedural votes and issues that we have addressed before. But not one query about the priorities of this spending bill, not one query on the usefulness of our spending on these issues. I'm assuming you're going to vote all against it, the Republican Party. And yet we tried from the very beginning to be completely transparent and open and provide a pathway to help Iowans, not who are just vulnerable, which is what you think this bill does, but providing independence for seniors, providing provider increases for child care workers, direct care workers, providing a mechanism for direct care workers to provide better quality care for our grandparents and disabled Iowans. We looked at provisions that would really make good contributions to making Iowa the healthiest state in the union, and yet there was no discussion. We've had the ability in the past 3 months to look at the priorities of how we spend our money. And with the passage of this bill and the passage of all the bills that the Democrats are proposing, we will still be $25 million below our Republican governor. That's good. We are looking at priorities within the realm of our governor and looking at how we could arrange these spending habits so that we respect the reserve accounts that we have, respect the general balance that we will have at the end of this fiscal year, and at the same time maintain the priorities and the protections for our seniors, for our children, for our doctors and hospitals that are at risk of losing money, and for the Iowans hardest hit on this recession. So let me repeat that this is a good bill. And from the discussions we had today, you didn't disagree with any of that. And if we had taken your amendments, would you have passed this bill? And what relevance is that on spending? Okay, we didn't take your amendments. So the heart and soul of the work for 3 months is how we spend taxpayers' dollars on making our Iowa families safer, healthier, and better. We had a discussion on tobacco, and I think you had 2 personal stories, and yet we fight our Republican colleagues in the legislature from zeroing out tobacco reduction strategies. Today, the Department of Health is overspending its quick line dollars because more Iowans are asking for help to kick the habit. We're not being overly generous. We work within the executive branch of how they disperse that money. It's reasonable. And we would like to have your support. We'd like to have your support in helping seniors so they have a quality life toward the end of their lives. We're asking your help to support children who clearly are the most vulnerable in foster care, in daycare, in hospitals, in families that are at risk. We have put together a budget that will wrap Iowa Values arms around the children that need the most help. That's what you will be supporting today. I'm not going to talk about whether or not I quoted Harry Truman correctly. I quoted the Constitution correctly, and the intent of providing and promoting general welfare for everybody is in the heart and soul of this country, and it's represented in this budget. So I ask you, to support a bill that provides the protection that we need in this state at a spending level when accumulated with the other budget bills, which will be lower than the governor's budget. This is a good bill. And I had extraordinary help from Senators Reagan and Volcom, of course our caucus staff, Chris Bell, and our Legislative Service Agency provided us with the information. And I want to thank the departments and their representatives that came and worked with us to look through and to decide how we were putting this together. This is really a good example of how this system works. So, ladies and gentlemen, I'm really proud to provide you an opportunity to vote for a bill that actually helps people and puts them first. Thank you, Mr. President.